Okay, so we're going to pick up now on achieving HIV health outcomes with housing, with the Housing HIV Care Cascade, a New York City HOPWA program. And your program says John Rojas and Rachel Johnson from the New York City Department of Health and Mental Hygiene are going to be here, but they are unable to be here for a very important reason. They are part of the Ebola response team in New York City, so unfortunately they couldn't be with us. But Ginny Shubert is going to ably present make their presentation. I'm going to introduce all of our speakers first, and then let them dig into the work. Ginny is a principal of Shubert Policy Associates, a public policy consulting group that supports the development and implementation of public policies and programs that impact low-income people and communities. She has 28 years experience as an advocate, service provider, and consultant working on poverty and health issues, including homelessness and access to housing. She's worked on HIV/AIDS, tuberculosis, and behavioral health. And Ginny has, Ginny currently, in addition to working with NAC on the Housing and HIV/AIDS Research Summit Series and the Strengthening Communities Project, Ginny directs the public policy and research departments at Housing Works, a major AIDS housing and service organization in New York City.
Thank you, and I want to thank John and Rachel for entrusting their presentation to me. We have a wonderful atmosphere going in New York State right now, with really close collaboration among state and local government and the HIV/AIDS and housing communities to on our governor's newly announced plan to end AIDS as an epidemic in New York State by 2020. So even though I have sued the city a number of times in former jobs, so has the head of our Human Resources Administration. So that gives you a sense of where we are in New York. So this first slide, and I'm just going to be really quick, and want you to note John's contact information at the end so that you can direct questions to them. And the PowerPoint will be available online after the conference today. This is just an overview of the history of the HIV epidemic in New York State, New York City in particular, which has 80% of the cases in New York State. New York City has always borne the highest burden of the HIV epidemic in the U.S. since the 80s. And as you can see, we've had some really dramatic progress in New York City and New York State over the past 10 years or so, with rapid declines in the number of new diagnoses and deaths among people living with HIV, which is what makes us believe that we have a real shot at bringing an end to AIDS as an epidemic in our city and state by 2020 by reducing incidence to a very low level, bringing people who are currently undiagnosed into care, and significantly reducing late diagnosis and HIV-related deaths. And I'm happy to talk to anybody during the breaks about our new state task force on the end of AIDS. The HOPWA program in New York serves a large number of people, folks with HIV-related illnesses who are served by the city's Division of HIV/AIDS Services, which is a special unit, a sort of one-stop shopping in the city's Human Resources Administration. There are a number of types of housing assistance provided, including a program of rental assistance that is state and city funded that currently serves over 25,000 people with HIV in New York City. Housing placement assistance, and of course supportive housing which, as you'll see, is particularly effective for people with complex needs. We have a rich source of data in New York City, especially since the New York City Department of Health and Mental Hygiene began requiring name-based reporting, not just of diagnoses, but also of all laboratory test results for viral load and CD4 values. And that makes it possible for us to really take a close look. Someone mentioned the importance of data, and I do agree with that, because it's hopefully going to help us to target efforts in New York City. What I'm going to show to you now is something that John and his colleagues at DOHMH have been working on for a while. They have the ability to match the HOPWA service database with the HIV surveillance data in New York City, which enables them to really look at the continuum of care or the treatment cascade for different groups of people. And they're still trying to refine that, especially around key populations. But this particular graphic that I'm going to show you use the AIDS registry data to approximate care visits and viral suppression among people in the HOPWA program. So we've already seen today the U.S. HIV care continuum with 25% overall and 30% of folks diagnosed achieving viral suppression. I wanted to just, this slide, and you can look at it in more detail when you have the PowerPoint in front of you, basically explains how the data was analyzed to get to the cascade that I'm going to show you for the HOPWA clients in New York City. As you can see, there were some assumptions made using the viral load and CD4 testing results to determine or to classify folks as linked to care, engaged in care, or on ART. And for example, for ART, the metric that they use is any indication in the surveillance data that this person has had a suppressed viral load at some point in the past 10 years. So as you can see, among clients who are served by the HOPWA program in New York City, the continuum of care or treatment cascade, we're doing much, much better. There's still areas for improvement, particularly in the drop-offs from engaged in care to on ARVs and then virally suppressed. But as you can see, 69% of the folks in this program are virally suppressed. And just to give you a comparison, in New York City as a whole, we're doing much better than the country as a whole. We're at about 44% viral suppression for the city as a whole, and as you can see, the HOPWA clients are doing much better. And again, remember, this is folks who use a range of housing programs. There are some stark differences between the cascade for different models of housing, and as you can see, folks in supportive housing are doing the best. And folks in emergency housing, which in New York City for this population are commercial single-room occupancy hotels, have the lowest rate of viral suppression, and they probably have the greatest number of complicating issues that they're unable to address because of the transient nature of their housing. But folks in permanent supportive housing are doing quite well. So this next part of the presentation, I'm just going to give you a quick overview, and I would encourage you to look at the PowerPoint and to direct your questions to John and Rachel. They've been doing a great deal of work trying to help conceptualize how local jurisdictions could do a HOPWA cascade of their own, and we're going to talk about this in one of the breakouts this afternoon, and it's already been mentioned, it's really critically important for housing programs to figure out how they remain meaningful and are recognized as HIV prevention and care in new systems of care. So these are just a set of different metrics that are used by New York City and that would be required to develop your own treatment cascade or continuum to demonstrate the role of housing in prevention and care at your agency or in your community, your state, et cetera. including obviously the ability to somehow link surveillance data or treatment data with housing data. I'm not going to go through all these options, but there are different pathways that John and Rachel have conceptualized that could be used as a guide to help people figure out what they need and then how to use it to develop a cascade. And again, I would encourage you to direct any questions you have about the New York City data or how to realize this in your own community to John or Rachel at their address in New York City at the Department of Health and Human Hygiene. So, I mean, yeah, department, yes. Mental hygiene, sorry.